So what are the clinical features of a woman who's infected with COVID? So usually the features are similar to that of a non-pregnant individual. Whatever it is, we all know, right? Rhinorrhea, fever, myalgia, loose stools, anosmia, all those features. The features are usually severe. So for all these features to settle, it takes around 5 weeks. In some women, it can also occur for more than 8 weeks. So more than 8 weeks also, these people can have these symptoms. For them, the symptoms resolve can take around 8 weeks also. So usually the median period is around 5 to 8 weeks. So sometimes what happens is that potential complications can also occur. So as I told before, because of the immunocompromised state, if the patient is obese or if she's age is more than 35 or any other chronic illness, serious complications can also occur in 2 to 3% of the individuals. So what are the potential complications? The first one will be the respiratory disorders. So it can be pneumonia, respiratory failure, ARDS, cardiac disorders such as arrhythmia, cardiac failure, thromboembolism, because COVID causes hypercoagulability and that can lead to thromboembolisms complications. Secondary infections can occur, acute kidney injury and various neurological disorders. So what is the outcome of in pregnancy and also what is the outcome of the newborn? So usually, as I told before, this Delta variant has been associated with higher risk of maternal illness, placental dysfunction and fetal compromise than the previous variants. The overall rate of congenital infection is found to be 2.7, which is very, very low. Congenital infection is that the baby is getting infected when it is in the mother's womb itself. So when it's getting infected, congenital infection rate is very, very low. And how does it occur? So usually the baby can get the COVID in 3 possible ways. One can be the in utero transmission, which occurs by the hematogenous route, where all the virus goes and seeds in the placenta, and from the placenta it gets transferred to the baby. One such factor can cause in utero transmissions, and also sometimes through the ascending route. In certain cases, studies have found out positivity of this COVID PCR in the vaginal fluid, which is very, very rare. And in such cases also, through the ascending route, infections can go to the baby and cause congenital COVID to the baby. So the baby can get congenital. The second one is during delivery. So these 2 points I told you now. Mostly the placentas, they don't have any evidence of infections, but some placentas have shown the positivity of virus. Positive vaginal swab and amniotic fluid has been reported in very, very rare cases. So what happens is that in our vaginal fluid and amniotic fluid, it is very little, it is very rare. But this virus is more in maternal feces. And what happens during labor when the mother is straining, these feces also come in when enema is not given, when she's coming in active labor. When she's passing feces, there might be the fecal contamination during delivery. It can go and infect the baby, and the baby can acquire the infection during the intrapartum period. So one will be the congenital infection by the hematogenous route or ascending. The second one will be during delivery because of the contamination by the infected fecal matter of the mother. And the third one, which is the most common one, will be the postnatal transmission. This postnatal transmission actually occurs through the breast milk, through skin-to-skin contact with the baby and various other factors, because of close contact when the mother is not following proper hand hygiene, when she's not wearing a mask. So all these small factors can lead to postnatal transmission to the baby also.